minutes. The chair recognizes the gentleman from Iowa.
Thank you, Mr. Chairman. Amendment 266 is the amendment that has had a lot of discussion around this chamber and around this country. And what it does is it recognizes the results of this CRS report, Mr. Chairman. This report dated just last Thursday, February 10th, 2011. It took a long time to put all the numbers together in an official document that identified the money that are automatically appropriated in Obamacare. And digging that out, there are dozens of locations that automatically trigger appropriations that go on in perpetuity, and that total in this report is $105.5 billion. And here we are in this this continuing resolution. The CRS report says $105.5 billion. I've been working on that for some months, and finally we came with a total. But if we're not able to shut off all of the funding that is automatically appropriated in the Obamacare legislation, both components of it, the reconciliation package and the bill itself, then forever this money goes forward and the administration aggressively uses it to implement Obamacare. So at that point, I would reserve the balance of my time.
Gentleman reserves. Lady.
I claim the time in opposition.
Gentlewoman is recognized for 5 minutes, claiming the time in opposition. Does the gentlewoman continue to reserve your point of order?
Yes, I do. Yes. Let me just very briefly, let me yield myself about 30 seconds.
You're recognized for 30 seconds.
This amendment will add to the deficit the next year, $3.5 billion, and over the next several years, $5.6 billion. It will not create a job, and once again would put the American people back in the hands of the insurance companies without the ability to be able to get the kind of health insurance that they require to deal with any illness that may befall them. And with that, let me yield to the gentleman from Texas, Mr. Green, 1 minute.
Texas is recognized for 1 minute.
Thank you, Mr. Speaker, members, and thank my colleague from Connecticut for yielding to me. Let me first say that I've read the bill. I was on the subcommittee and the full committee and served on the health subcommittee for many years, and I had many people ask me that. And believe me, when you spend hours and hours literally in testimony and amending the bill, you have the chance to read it. And I would hope my Republican colleagues and all of us would use the same thing, our appropriators. I would hope they would read the appropriations bill if they're accusing us on the Energy and Commerce Committee or who helped draft that bill. What this amendment would do would take away the funding that the Department of Labor and Health and Human Services would be able to enforce, that insurance can't drop someone for coverage when they become sick. They would take away that funding. Seniors would be saving money. They couldn't enforce it, saving money for seniors for prescription drugs. Young adults under 26, up to age 26, are getting back insurance for their parents. That would stop the Department of Labor and Health and Human Services from enforcing that law. Small businesses are receiving billions of dollars in tax credits to provide health care coverage. This would stop it. Defunding health care would end these benefits and putting insurance companies back in charge. The whole goal of the health care bill, whether you call it Obamacare, I'm kind of concerned. I wanted it to be called the Gene Green Care bill. But I admit I'm only one of 435. But that's what this bill is about in this amendment. It will defund the great things that's in the health care law. Let's go back and talk about the things we all agree that need to be changed. But if you take away the money, we'll lose this for all our folks in our districts. And I yield back my time.
Gentleman yields back. Gentleman from Iowa.
Mr. Chairman, I'd be very pleased to yield a minute and a half to the gentlelady from Minnesota, Mrs. Bachmann.
Gentlewoman from Minnesota is recognized for a minute and a half.
Thank you, Mr. Speaker, and I thank Mr. King from Iowa. Make no mistake about it, Mr. Speaker, the effort on the part of Steve King is to defund Obamacare. This chamber already passed a bill to repeal Obamacare, which the American people have asked. This is now an effort to defund Obamacare, because as we have seen from the Congressional Research Service, the ingenious nature of the Obamacare bill was to already put the funding in place so that if the majority lost the gavel, which they did, the new majority would be unable to defund this bill. Speaker Pelosi said it well last year when she said we had to pass the bill to know what's in it. We only found out recently that literally tens of billions of dollars have already been appropriated to fund Obamacare. It was put in, quote, mandatory spending, spending where this chamber would not have access to be able to defund the bill. If we are unable to defund the bill now, make no mistake, Mr. Speaker, this chamber and the American people will do everything they can to make sure they put into place a new president, a new Senate, and a House that will have the requisite courage to finally defund the government takeover of health care. And I yield back to the gentleman from Iowa.
The gentlelady yields back. The gentlewoman from Connecticut.
I yield 2 minutes to the gentlewoman from Wisconsin, Ms. Baldwin.
Gentlewoman from Wisconsin is recognized for 2 minutes.
Thank you, Mr. Chairman. I rise in opposition to this amendment and in opposition to the underlying bill. I fail to see how Republican efforts to eliminate all funds for health reform will create jobs or help our fragile economy recover. Instead, defunding health reform would leave behind thousands of whom I represent in Wisconsin, thousands of Wisconsin families who have already begun to experience the benefits of health care reform. Should the Republican efforts succeed, tens of thousands of young adults in Wisconsin would stand to lose their insurance coverage through their parents. Once again, children would be refused insurance, discriminated against because of pre-existing conditions, and nearly 50,000 Wisconsin seniors would face higher prescription drug costs. What's more, the efforts to defund the health care reform law come on top of extreme cuts to community health care centers and family planning clinics. While I agree with my Republican colleagues that we must reduce the deficit and bring the budget into balance, we must be smart about it, and this amendment is not smart about it. This unwise bill jeopardizes our nation's health, our nation's recovery, and our nation's future, and is particularly troublesome to me this week because it falls on top of efforts by Wisconsin's governor to cut health, education, and public safety services and to take away the rights of public servants to provide them. Mr. Chairman, today I stand in solidarity with my fellow Wisconsinites as I fight for a better future for all Wisconsinites and all Americans. I urge my colleagues to oppose Republican efforts to defund the health care reform law and to oppose the underlying bill.
Generally yields back. The gentleman from Iowa.
Mr. Chairman, I would be pleased to yield a minute to the gentleman from Georgia, Mr. Gingrey.
Gentleman from Georgia is recognized for a minute.
Mr. Chairman, thank you, and I thank the gentleman for yielding. I stand in full support of the King Amendment. I was at the well just a few minutes ago in support of the Rehberg Amendment. But what this amendment does is stop the funding, the $100 billion worth of funding that was automatically put in this bill to prevent, if we took over the majority of this House, Mr. Chairman, as we have done, try to stop us from stopping the worst bill that's ever been passed in the history of the Congress. And we have to do this. This is a pledge to the American people. We can do it. We can start over. We can make this bill right. We can enact health care reform that truly does bring down the cost for patients so they can get access, they have more control, and that we don't destroy the medical profession in the process of continuing this wrong-headed, boneheaded Obamacare bill. So I want to stand strongly with my colleague from Iowa in supporting this amendment, and I yield back the balance of my time.
Gentleman yields back. Gentlewoman from Connecticut.
I yield 1 minute to the gentleman from Oregon, Mr. Blumenauer.
The gentleman from Oregon is recognized for 1 minute.
I appreciate that. My friends on the other side of the aisle talk about listening to the American public. Well, I've been back home in my district meeting with providers, people in the insurance industry, hospitals, nurses, and they are dealing with this plan moving forward. They're excited about the opportunities to take advantage of it. The protections that are underway in the law right now are popular with the public because they're important to the public. My friends talk about listening to the American citizens. The Associated Press pointed out in a poll last month that the overwhelming majority opposed the notion of trying to defund health care, and in fact in that same poll 43% thought the protections should be expanded. We are in a situation now where we can make a profound difference in improving the quality of health care in this country while we reduce deficits. Putting sand in the gears, arguing, trying to create confusion is not moving us forward. Work with our hospitals, work with our doctors, work with our citizens, make this work for America.
Gentleman from Iowa.
Mr. Chairman, how much time does each side have remaining, please?
Gentleman from Iowa has 1 1/4 minutes remaining, and the gentlewoman from Connecticut has 30 seconds remaining.
In that case, then I would reserve to close.
Gentleman reserves. Gentlewoman from Connecticut.
Do I have the right to close, Mr. Chairman?
Yes. The gentlewoman from Connecticut has the right to close in opposition to the amendment.
Thank you, Mr. Chairman.
Wait, does the gentlewoman from Connecticut, are you reserving?
Yes, I'm reserving.
All right. Gentleman from Iowa.
Thank you, Mr. Chairman. This amendment, amendment number 266, someone put the moniker on it, the Silver Bullet Amendment. And as much as we have all worked here to try to find the right way to shut off all of the funding, to freeze in place the implementation and enforcement of Obamacare, many of us have worked in a number of different ways. This is the one, the amendment that goes back and looks at the pattern that was set, that I understood back in 1974 when there was a CR before the House of Representatives that shut off all funding that would go to the Vietnam War for offensive or defensive operations in the air, over, the land of, the seas adjacent to, or the countries adjacent to it. That language covered everything, and it stopped bullets on the dock from going into the hands of people to defend themselves. I disagree with the policy, but the foundation is here in multiple places in the history of this Congress. This is the language that shuts off the funding of Obamacare until such time as H.R. 2 becomes law. That's the repeal legislation that becomes law. This is H.R. 1. It's completely appropriate that H.R. 2 and H.R. 1 are married together, and that we shut off the funding for the implementation of Obamacare, all of it, the entire $105.5 billion that were slipped into this report that we just got back last February 10th. So, Mr. Chairman, I urge the adoption of this amendment, and I would yield back the balance of my time.
The gentleman's time has expired. His time has expired. He yields back his time. The gentlewoman from Connecticut.
I urge my colleagues to oppose this amendment. What we need to be doing is to focus on jobs, to grow the economy, and to reduce the deficit. This amendment does none of the above. Essentially what it does, it takes us back into the hands of insurance companies when they had free rein to raise rates, to reject claims, and deny coverage to families and businesses who would have no recourse. It protects their CEO bonuses and their corporate profits. We need to be about the business of creating jobs. This amendment does nothing to do that and increases the deficit. It should be absolutely clear to everyone here and everywhere else what this amendment does. Mr. Chairman, I make a point of order against the amendment because it proposes to change existing law and constitutes legislation on an appropriation bill and therefore violates Clause 2 of Rule 21. And the rule states in pertinent part, and I quote, an amendment to the general appropriation bill should not be in order if changing existing law. Waives existing law, and I ask for a ruling from the chair.
Gentlewoman from Connecticut has stated a point of order against the amendment. Is there anyone who wishes to be heard on the point of order? Gentleman from Iowa.
Thank you, Mr. Chairman. This point of order that has been raised on my amendment that I referred to as the Silver Bullet Amendment, I think does not consider a duty that we have here in the House of Representatives, and that is we stand here and take an oath to uphold the Constitution of the United States. Each one of us. I bring in my Bible to do that. And I take it very, very seriously when we take an oath to uphold the Constitution. We don't take an oath to uphold a rule, but we take an oath to uphold the Constitution. And as I look into this Constitution and read through it, Article 1, Section 5 reads in pertinent part, each House may determine the rules of its proceedings. And because each House can determine the rule of its proceedings here in this Constitution, you have in your hands the gavel, Mr. Chairman, and the power and the authority to determine those rules, at least to make a strong recommendation to this body. And I would urge that we understand that 2 federal courts have found this bill, Obamacare, to be unconstitutional, and it is immoral and unjust and irresponsible to waive any opportunity to shut off the billions of dollars that are automatically appropriated in a deceptive fashion and continue for the implementation of Obamacare because we might think somehow that a rule would trump the very Constitution itself. And I'd yield back.
Is there any other member who wishes to be heard on the point of order?
Chair, I do.
Gentleman from New York is
Mr. Chair, I
recognized.
agree with the gentleman. His amendment is clearly in order. But I know this because if this were legislating on this bill, that would mean that they can legislate. They control the House and the Senate and the presidency. They were unable to legislate. We're here for 8 weeks. They've been unable to legislate. It's impossible to believe that he's legislating in this bill. The point of order, if I may speak to it, the point of order suggests that the gentleman is legislating on an appropriation bill. I've watched those guys. They're incapable. There's no way this is legislating. So I believe the point of order should be struck down. It is impossible. After 8 weeks, they haven't legislated. They had 8 years in the majority. They didn't legislate. How could it possibly be, Mr. Chairman, that the point of order is correct? The gentlelady from Connecticut is rarely incorrect, but if you think they're legislating, impossible, almost metaphysically impossible for the gentleman to be legislating. He doesn't know how. How would we possibly have the legislating in this bill? I think the gentleman is absolutely correct. Let us have this debate, because if it is that moment, if lightning is striking, if it is chilly in hell, then maybe this is the moment we've been waiting for. The Republican majority is going to start legislating. Please, praise God, maybe this is the moment. So I think the gentleman is correct. He is not legislating in this bill because it is impossible for them to do so because they simply don't know how.
The chair is prepared to rule and has been entertained. On the point of order, is there no other member who wishes to speak to the point of order? Chair finds that the amendment proposes to supersede existing law. As such, it constitutes legislation in violation of Clause 2C of Rule 21. The point of order is sustained.